So let's go for this bullet points. Very favorable, very favorite. The bullet points. Just we will try to revise on YouTube so that it will be easy for us. The first branch of internal carotid artery, ophthalmic artery. Numbness over the lower lip of the tooth extraction, inferior alveolar. Loss of sensation, side interior of the tongue. General sensation, lingual nerve. Branch of, this is from the trigeminal nerve, mandibular division of trigeminal nerve. Submandibular gland injury, patient tongue deviation, hypoglossal, same site. Hypoglossal nerve, tongue deviation on the ipsilateral side. Any of this internal carotid injury, internal carotid, some removal of embolectomy, hypoglossal nerve. Nerve injury during subglandular gland surgery near the duct. Duct is angulating, that is lingual nerve. Most common nerve injury in the cavernous sinus. Sixth nerve has got a long course, that's why cavernous sinus. CNS tumor with a vagus and glossopharyngeal nerve palsy. Two nerves, 10th and 9th, vagus. Medulla, it is medulla. 9th, 10th. So you have got 2, 2, 4, 4. Unilateral soft palate, tongue, reduced sensation. This is soft palate and tongue, reduced sensation. Site of compression is in medulla because the nerves arising to this again is the medulla. Midbrain, pons, medulla. Medulla has got 4 nerves, last 4 nerves, 12th, 11th, 10th, 9th. So this, the 9th is glossopharyngeal, 10th is vagus. So posterior soft palate and everything has got from the vagus. Which cranial nerve that doesn't contain parasympathetic fibers? Optic is also olfactory optic. Third nerve contains parasympathetic. Cranial nerve that doesn't parasympathetic. It is not just optic. Even the nerves. Third is ciliary. Fourth, fifth, they are got trochlear lateral rectus. They also don't have parasympathetic. This is a motor nerve. The parasympathetic is 1973. 1973. 10973. They contains the parasympathetic. Level of compression of third cranial nerve. So third cranial nerve, olfactory optic, oculomotor, is midbrain. So second is 1, 2 is from the general brain, from the forebrain, or you can call it cerebrum, and midbrain, pons, medulla. Midbrain has got 2 nerves. Third, fourth, pons has got 4 nerves, medulla has got 4 nerves. Numbness at the chin, mental nerve. Chin, mental nerve. Branch of inferior alveolar, mandibular branch division. Numbness over the cheek, infraorbital. This question is coming, infraorbital. Nerve supplying forehead via eye. From the eye, forehead, supraorbital. Numbness over lower lip, inferior alveolar again. Numbness over lower lip and paralysis of muscles of mastication. There is numbness as well as paralysis. Mandibular branch of trigeminal nerve. Mandibular branch of trigeminal nerve. With intracranial increase intracranial pressure, which is commonly affected. Sixth nerve has long course, that's why intracranial pressure causes common effect. Single test to differentiate between upper and lower motor neuron in facial elevation of the eyebrow. Nerve injury during parotid surgery. Whenever you are doing parotid surgery, injury to the nerve is facial nerve. During parotid, most commonly injured nerve during parotid surgery is greater auricular actually. Greater auricular, it is superficial nerve. Nerve injury during superficial dissection is greater auricular. During deep is parotid, and parotid surgery is facial. And nerve injury during parotid gland surgery, dropping lip, asymmetry, marginal mandibular branch of facial nerve, marginal mandibular facial nerve. Hoarseness of the voice, weak vagus nerve, recurrent laryngeal nerve, which gives motor supply to trapezius and sternomastoid accessory. Nerve in posterior triangle, spinal accessory, posterior triangle. This question is Patient unable to shrug the shoulders, spinal accessory. Patient with torticollis, again spinal accessory. After endarterectomy, hypoglossal. Numbness at the angle of jaw. Angle of jaw. This is greater auricular. Supply to the angle of jaw, greater angular. Branch from cervical, C23. All of the following passes through superior orbital fissure except ophthalmic artery, which passes through optic tract, but ophthalmic vein passes through superior orbital fissure. Ophthalmic artery passes through optic canal with SOF, third, fourth, V1, sixth, and ophthalmic vein. Maxillary rotamax, mandibular oval, oval. Maxillary nerve passes through maxillary nerve. Maxillary is through, this is something different, not jugular foramina. Middle meningeal artery spinosum, this is common. Internal carotid artery lacerum, also internal carotid canal. This question is coming, canal. Hypoglossal passes through hypoglossal, anterior condyle foramen, ophthalmic nerve, olfactory, ophthalmic division of mandibular, this is V1. Cerebropontine angle lesions commonly affected, actually 7th and 8th. Vagus, and 7th is facial and vestibulocochlear, these are common. Acoustic neuroma. Patient hit on the vertex superior sagittal sinus. Vertebral artery is a branch of subclavian, first branch. Vertebral artery passes through foramina at C6. Fracture of middle third of the clavicle, subclavian vein is very much close. Branches of internal carotid artery, anterior cerebral, middle cerebral. Stroke with anterior cerebral, lower limb, anterior cerebral, lower limb. Not contained in the posterior triangle, uncis cervicalis. Contained in the posterior triangle, spinal accessory. Phrenic nerve is in posterior triangle of the neck, then comes on the scalenus anterior over this. During thyroidectomy, infraheart strap muscles are divided near the upper part. Neurovascular structures in parotid gland. Facial nerve, then retromandibular vein, then external carotid artery. And again facial nerve, basally retromandibular vein, external carotid and two terminal branches. Pharyngeal pouch lies between cricopharyngeus and thyropharyngeus. Hassel's corpuscles, thymus. Nucleus of glossopharyngeal is in medulla. Glossopharyngeal nucleus is in medulla. Trigeminal nucleus in pons, TGP. And glossopharyngeal, GM, TGP. Layers of skull, skin, dense connective tissue, aponeurosis, loose connective periosteum. Danger area of the skull, emissary veins, intracranial, extracranial, loose connective tissue. Sensation of the scalp, cervical branch behind auricular, greater auricular, and anteriorly there is trigeminal. Internal carotid branches in the neck, no branch, 0. Venous drainage of the scalp through the facial vein. Then posterior triangle of the neck has trunks of brachial plexus. Subclavian contains division of brachial plexus. Axilla contains cords of the brachial plexus. Supraclavicular traverses cervical branch, thyrocervical artery. Swollen subclavicular lymphatics of the neck, inferior of the humerus. Structure passing through posterior triangle. Sides of cranial nucleus, cerebral hemisphere 2, midbrain 3 plus, this is cerebral hemisphere 2 nerves, 1, 2, 3, 4, midbrain, pons 4 nerve. Parasympathetic ganglion 1973. 3 is ciliary, accommodation and constriction, pterygopalatine lacrimation, submandibular, sublingual for secretion, parotid for gland. Tongue movement now, hypoglossal, tongue lymphatic drainage, metastasis, anterior 2/3, metastasis to which gland? Nerves. So, chorda tympani is test, sensation lingual, anterior lymph nodes in the tip submental, anterior to third unilateral submandibular, and then deep cervical, then sensation posterior lymph node to the upper deep cervical. CSF flow lateral to third moon is above, then third to fourth by aqueduct, then lateral to is dorsal ganglion carry parasympathetic, dorsal ganglia parasympathetic, lateral wall of the spinal cord sympathetic. Submandibular is duct is Wharton, open in the frenulum, parotid stensons, second upper molar teeth. A course of recurrent laryngeal nerve, right side runs around the subclavian artery, left side is from the arch of aorta, this subclavian artery that is below. Superior thyroid artery is a branch, external carotid artery drains into internal jugular vein. Inferior thyroid artery forms right thyrocervical trunk brachiocephalic vein. Course of recurrent on the left side, arch of aorta. Hyoid is C3, bifurcation is C4, cricoid is C4, site of angle of arch of aorta T4, pulsation of common carotid artery T6, referred pain on the ear due to glossopharyngeal nerve, abduction sixth nerve, lateral rectus muscle, can't look laterally. SO4 superior oblique, patient can't look downward, that is read walking stairs. Prominent C vertebra felt behind neck is C7. Hyperacoustic facial nerve because nerve to stapedius, vertebral artery posterior inferior cellular pica, basilar artery superior and inferior cellular artery, circumference 2 internal carotid T plus 2 vertebral artery. Source of bleeding due to lumbar puncture, vertebral venous plexus, cervical vein which has long bifid spine. Cervical vertebra long bifid spine axis. Dorsal root ganglia is sensory, third ventricle aqueduct of Sylvius. Lateral horn of the dorsal spinal cord, sympathetic. What is the last to encounter during lumbar puncture? Ligament of flavum. First lumbar puncture encounter supraspinous, interspinous, ligament of flavum, never touch posterior ligament. Posterior ligament is the anterior part of spinal cord, and then anterior ligament is very much. So posterior ligament is never touched. CSF is collected from which space? Subarachnoid space, absorbed in the arachnoid plexus. This is arachnoid plexus and formed in choroid plexus. This is arachnoid granulations formed in choroid plexus. Bony mark iliac crest at the level of L4-5. So iliac crest, one hand is put on this. Adult spinal cord L1, children L3, level of lumbar puncture L3-4, children L4-5, nerve above. Spinal cord part carry sensory and temperature. Motor is anterior, sensory and temperature is lateral. Anterior surface of the heart is formed by right atrium and right ventricle. Posterior surface left atrium, left ventricle. Inferior is always right ventricle. Inferior surface of the heart attached to the diaphragm is right ventricle, not the right atrium. Right heart border, okay, right atrium, stab in the right side of the sternum, this is right. Left border of the heart, left ventricle, and above is left ventricle. Inferior border, right ventricle. This is what inferior border, right ventricle, apex by the left ventricle. So left coronary passes behind the pulmonary trunk. Left coronary. Right coronary originates from the anterior aortic sinus, left coronary from the posterior aortic sinus. This is important. Then right coronary origin, right cusp, above the right cusp, above the left cusp. Not contained in the posterior mediastinum, vertebral bodies are outside. Coin in the esophagus reach somewhere opposite to T10. What is the distance from T10 is actually opening of the esophagus in the diaphragm, so it is 40 centimeter. A coin at the esophagus C3 level, which is narrowing at C3 to 15 centimeter. T4 is 25 centimeter from arch, T5 is 28 centimeter. Aortic arch, cricoid, aortic, esophagus has no serosa. Vagus nerve in inverted SA node, indirect innervation, not direct. Vagus nerve innervation to SA node, indirect, not vagus plexus. Murmurs of the heart, auscultation, aortic, pulmonary, tricuspid, mitral. Aortic on the left side, second, pulmonary on the right, second, tricuspid is down, fourth, right of the sternum, mitral on the down, left, fifth. Aortic, left of sternum, second. Aortic is right, and pulmonary is left, second. So let us see this. Okay, I'll do it. Patient has superior vena cava on the left side. Superior vena cava anomaly opens coronary sinus. Great cardiac veins drain in anterior interventricular groove. Passes middle cardiac vein in the posterior interventricular groove. Pleura of the lung, nerve supplied by intercostal and phrenic nerves. Branches of abdominal aortic exist against the body of L2. Renal, right superior vena SMA is L1, LMA, IMA is L3, middle sacral here. Alpha is the division of IVC. L4 is vena cava. This aorta division into common. Most inferior single branch, middle sacral. Most inferior anterior branch of aorta, inferior mesenteric artery. Location of the celiac mesenteric. Location of celiac mesenteric, right anterolateral and posterolateral on both sides of aorta. Right testicular vein drains into inferior vena cava. Left testicular, left renal vein. Right gastrophilic branch from gastroduodenal artery. Left gastrophilic branch from splenic artery. Gastroduodenal branch from the hepatic artery. Right gastric artery is from hepatic artery. Left gastric artery is from the celiac trunk. Left gastric vein drains in splenic vein. So this is actually left gastric vein is superior mesenteric vein and splenic vein. They both join to form, along with the splenic vein, inferior mesenteric vein joins the splenic vein and superior mesenteric both join to form portal vein, and there is left gastric vein. This is not true. Drain into splenic vein, no. Gut rotation occurs around SMA to 270 degree anti-clockwise. Anti-clock. Gastric veins drain in this is what? Portal vein. Left gastric vein drains. Splenic vein passes through linorenal ligament. Short gastric vein supplies to gastrosplenic ligament. Inferior and short gastric vein drains in splenic vein. Right and left gastric vein drain in portal vein. So right gastric drain in superior mesenteric vein. Cystic artery of the gallbladder comes from right hepatic artery. This is right. Common hepatic artery gives gastroduodenal artery. Blood supply from the superior esophagus. Blood supply of superior esophagus from inferior thyroid. Most of the time, top of the esophagus. Large vessel is identified during Whipple's is superior mesenteric artery. Inferior mesenteric vein drains into splenic vein. Splenic vein and superior mesenteric vein join to form portal vein behind the neck of pancreas. Perforated gastric ulcer at the wall of anterior wall, right gastroepiploic artery. Then, true as regard with the lesser sac is portal vein is the anterior free. Relation of third part of the duodenum, which is not in relation, is third part of the duodenum, actually right kidney is there. Option. Posterior duodenal perforation, gastroduodenal artery, there is severe hematomesis. Right hemicolectomy, which is ligated right colic artery, blood supply of transverse colon middle colic, blood supply of left colon is inferior artery causing ischemia to the colon is splenic flexure at inferior mesenteric artery, artery ligation of anterior resection is inferior mesenteric artery. During left hemicolectomy, ligated not affection circulation upper left colic artery from that is artery of Drummond. From sigmoidectomy, during sigmoidectomy, ligated to stop bleeding from distal colon is left colic artery. Colored triangle medial border is hepatic duct. It's a common hepatic duct actually. It's hepatic duct. Hepatic duct, common bile duct. Then this is like this. Two hepatic ducts, they form the common hepatic duct. Then the cystic duct joins it. Here the cystic duct, it joins it. And there is common duct CBD. This is common hepatic duct. This is right and left hepatic duct. This is cystic duct. This is the Callot triangle. Pringus animal, who is at direct risk of injury? Left renal vein compresses, nutcracker syndrome. This is left renal vein compression. Superior mesenteric artery compresses it. Cystic artery, cystic duct supplied by cystic artery. Common bile duct supplied by hepatic artery. Which vessel passes in front of uncinate process SMA? Anterior to neck of the pancreas, pyeloduodenum. Posterior relation of body of the pancreas. What is there? Left crus of the diaphragm. Upper end of the right kidney doesn't reach 11th rib. Left renal vein relation to superior mesenteric artery posteriorly. Posterior relation of first and second part, third duodenum is inferior vena cava. Which aortic arch is likely to be affected with aneurysm near the venous aortic branch, superior mesenteric artery? Left renal vein relation to left renal hilum. Vein is anterior. Relation of SMA and uncinate process. Superior mesenteric artery descends anterior to the uncinate process. Anterior relation of right suprarenal gland. What is there in front of right renal? Inferior vena cava and liver. Posterior relation of right suprarenal, right crus. Anterior relation of left suprarenal, stomach. In left veins descend anterior to left ureter, gonadal veins. Nerve injury after grid RN incision, ileoinguinal nerve. Nerve injury after hernia surgery, ileoinguinal, same nerve. While giving local anesthesia for inguinal surgery, femoral nerve may be affected, resulting in flexion, knee extension. Nerve injury, anterior resection or abdominal perineal excision, hypogastric nerve. This is hypogastric nerve. Erectile dysfunction is splanchnic, pelvic splanchnic injury. Erectile dysfunction is pelvic splanchnic. Fecal incontinence, pudendal. During ligation of short gastric arteries for splenectomy, tail of the pancreas. Amylase may be a suprarenal blood supply, three arteries, phrenic, suprarenal, aorta, middle, suprarenal, phrenic, suprarenal, renal artery, infrarenal. What are ureter relation? Posterior, anterior, bifurcation of common carotid, genitofemoral nerve, but anterior third part of the duodenum, gonadal vein. Not in relation, third part of the duodenum is tail of pancreas. Nerve blocked or cut at episiotomy, pudendal nerve. External spermatic fascia comes from external oblique appendage. Site of fluid collection, perforated appendix, pouch, rectovesical pouch. Scrotal, subcutaneous scrotum is dartos. Fibrous capsulin is albuginia. Natural constrictions of ureter, pelviuretic junction, brim, between intramural arrangement of scrotum, VVIMP. Per rectal examination failed posterolateral anal verge, 4 cm from the anal verge, seminal vesicle. Puborectalis muscle, question is coming most of the time is puborectalis. Blood supply of stomach and pancreas, look at that. Stomach and pancreas, long blood supply. Superior pancreatic artery is from gastroduodenal. Inferior pancreatic artery is superior mesenteric. Inferior pancreatic artery is from superior mesenteric artery. Rectum lymphatic drainage, upper pararectal inferior mesenteric, internal iliac lower Anal drainage above dentatus, internal iliac, below dentatus, superficial inguinal. What drains in para-aortic? Testicle, ovaries, and fundus of uterus. Tough in para-aortic. Fundus of uterus. In Cochlear's incision, which muscle is divided? Rectus abdominis. Open collision muscle divided rectus abdominis. Pyramidal incision displaces rectus to lateral side. P. fenestal fascia transversalis. Injury to conjoint tendon medial to epigastric vessels through the Hasselbeck direct inguinal hernia. Hernia lateral to epigastric indirect hernia. Location of femoral artery mid-inguinal point. Mid-inguinal point symphysis pubic artery. Location of deep ring midpoint of inguinal. Below the midway of umbilical, what will you find? Posterior no rectus muscle, anterior 3 umbilical area, lymphatic drainage. Above is axillary lymph node, below is inguinal lymph node. Neurovascular plane at the abdomen, internal and transverse abdominis. Below the arcuate line, found only transverse fascia. Muscle initiate abduction of the shoulder is supraspinatus. Radial head articulates in capitulum. Radial head in the annual ligament. Patient can't flex distal phalanx is profundus. Abductor pollicis of the hand is supplied by recurrent. Adductor pollicis by the ulnar nerve. Abductor pollicis is supplied by median nerve, recurrent branch. Patient on the hand, thumb to ceiling, he can't eat. Ceiling, he can't. Abductor pollicis brevis, this is median nerve. Abductor pollicis. Patient injured at the wrist on the medial side, pinch of a Fromet sign. Adductor pollicis, ulnar nerve. Fromets is for ulnar, this ceiling hand. Thinner muscle supplied by median. Test to assess median nerve muscle is phalanx test and Tinel sign. Carpal tunnel release muscles not injured is palmaris. What is the muscle above carpal tunnel is palmaris longus. Scaphoid blood supply from the distal pole. Necrosis proximal pole. Lateral relation to ulnar nerve to artery is ulnar to artery. Relation of median nerve to brachial is lamb. Winging of scapula serratus anterior. After execution, she can pick up the knife. Her wrist flexes. Posterior cord injury to radial nerve. Patient was injured in the axilla, has a weak grip and uses flexion when gripping something. Posterior cord injury again. Axillary nerve injury. Deltoid muscle is second most common in teres minor. Wrist injury, thinner eminence, atrophy, median nerve. Nerve specific for opposition is recurrent branch of median. Posterior opposition. Loss of thumb, adduction, ulnar nerve. Muscle extending the thumb, extensor pollicis brevis. Muscle abducting the thumb, adductor pollicis brevis. Loss of little finger, ulnar nerve. Intraossea, ulnar nerve. Midshaft humerus fracture, asparago-radial. Sensation over the medial aspect of the ulnar nerve. Patient cannot lift his hand from the table and cannot extend the DIP is radial nerve. Loss of pincer movement. Pincer movement is purely motor. Structures in the deltopectoral groove is cephalic vein, thoracoacromial artery, lateral pectoral nerve. These are the clavicle, middle 1/3, most commonly injured subclavian vein. Origin of supraspinatus, infraspinatus in dorsal aspect of scapula. Ventral aspect of subscapularis. Biceps muscle attachment to the humerus bone. Short head of biceps supraglenoid, long head of biceps coracoid process. Triceps is the infraglenoid. Anatomical snub box, posterior, ulnar or medial extensor. Posterior or ulnar or medial. This can be there. Posterior, ulnar or medial. EPL. Anterior, radial or lateral. Adductor pollicis brevis, extensor pollicis brevis. Relation of extensor indicis to extensor digitorum. Deep and ulnar. Extensor indicis and extensor digitorum. Patient felt outstretched carpal bone, lunate dislocation, injury to the hamate pisiform will affect ulnar side flexion digitorum profundus. Complete loss of extension and wrist, complete loss of elbow extension and wrist extension, lacerated wound 6 cm above the triceps tendon injury. Loss of extension. So 6 centimeter wound above the tendon. Extension, wrist extension, both are lost. So C 5 6 triceps. Radial nerve. Olecranon process, that is some cutaneous sensory radial nerve. Ulnar hypothenar dorsal palmar interossei function. So what is this ulnar hypothenar dorsal palmar interossei function? Dorsal abduct fingers, palmar adduct the finger, dab and pad. Supracondylar fracture, weak hands, median nerve. Supracondylar flexion, absent pulse, brachial artery. Injury to the arm not making mild claw is ulnar elbow, marked claw is wrist. Steel cervical rib is due to obstruction subclavian, diagnosed duplex. Numbness lateral aspect of the forearm, brachialis muscle, palm on the table, patient is unable to touch the paper with the thumb, extensor pollicis longus, hand is on the table and there is unable to bring the thumb to 90 degree, adductor pollicis longus muscle tendon, flex PIP and unable to flex DIP. Profunda digit sensory nerve supply for ring, ulnar, medial. Ring finger has got all three. Patient flex thumb when pincing paper. Fromet sign, adductor pollicis supplied by deep ulnar nerve. Cephalic vein course in the arm, joins axillary vein. Cephalic vein joins the axillary vein. Cephalic vein is lateral, basilic vein continues as the axillary vein. Both basilic and cephalic vein join together and form the median vein. No, where we do cannula, though they are joined by median vein where cannulation, quadrangular space axillary nerve and posterior cerebral vessels, triangular space down radial nerve profunda brachial artery. Borders of cubital fossa, roof is formed by bicipital aponeurosis, floor is formed by brachialis and contents medial to lateral MBBR. Median nerve, brachial artery, bicipital and radial nerve. Median nerve courses in the arm, lateral, anterior and medial from above downward. Debutant contraction of the palmar aponeurosis, do release it. Axilla is divided by parts spectralis major 1 behind 2 and 3. Incision axilla, watch out for above axilla, superior thoracic artery. Behind the axilla, thoracoacromial artery. Below the axilla, subscapularis artery, circumflex artery. Patient red cholecystitis came with the shoulder pain, sophronic access C34. Patient injured the neck in the football and accidental come to deformity, Erb's palsy. Upper trunk. Upper trunk Erb's, lower trunk is clump case. Claw hand Horner syndrome is the clump case. Brachial plexus medial cord, ulnar nerve. Brachial plexus posterior cord, axillary. Patient can't extend elbow, has a wrist, finger drop, radial at the axilla. Radial at the axilla, 3 drops. Finger drop, can't extend finger or thumb, posterior interossei drop. Patient had numbness on lateral aspect of the forearm. Lateral aspect of the forearm is musculocutaneous. Patient can't do OK sign and injury to interosseous nerve of the median. Anterior, this is interosseous nerve, AIN. OK sign AIN. Muscles, musculocutaneous nerve supply muscles, biceps BBC. Biceps brachia and coracobrachialis. This is the muscle called as brachioradialis, supplied by radial nerve. Best, it is different from brachialis. Okay, so brachioradialis by the radial nerve. Foot cuboid bone, distal articulation, 4th and 5th. Cuboid, 4th and 5th, lateral side. Cuneiform, 1st, 2nd, 3rd. MTP, medial. 5th 4 metatarsophalangeal joints. So cuneiform in the medial, cuboid is on the lateral. Structure passing in the lesser sciatic foramina. This is obturator, nerve, tendon plus pudendal vessels. Passing from the greater sciatic, gluteus muscle, hamstring, perineal muscles, pudendal nerve. Hip bone composed of ilium, pubic ischium. Muscles innervated in greater trochanter of the gluteus medius. Muscle inserted in the lesser trochanter psoas majus and flexes the hip. Anterior boundary of the femoral ring, inguinal ring. Posterior pectineal. Medial is lacunar. Lateral is femoral vein. Patient has hernia below and related femoral. Popliteal region most superficial is tibial. Deep is popliteal. During arthroplasty, surgeon noticed the artery is running in the superior border of pectineus. Pectineus, that is in adductor hunter canal, roof sartorius, floor adductor magnus, nerve supply to adductors the hip obturator internus. During TRP it is then structure passing below behind piriformis in the greater sciatic foramen. Sciatic nerve injury causing waddling is superior gluteal nerve, gluteus medius, over and mass obturator nerve. Injury during posterior hip is sciatic. During distal femoral approach, common peroneal nerve. Injury in the lower end of the fibula, Pott's fracture, nerve emerges at the lower border of psoas major causing numbness over the thigh. Lateral meralgia parastica, patient has foot drop. Sciatica, loss of sensation over first wave is deep peroneal, sensation over the medial leg. So loss of sensation on the medial side of the leg. During the medial ankle approach, saphenous nerve. Loss of sensation medial side is saphenous vein and saphenous nerve. During medial ankle approach, which nerve is affected? Saphenous. And during short sural nerve. Lateral is sural, knee scope, then sensory. Knee scope, then sensory loss just below the knee on the medial aspect, infrapatellar branch. Anterior compartment syndrome, leg pain is present on plantar flexion of the big toe. Numbness in the first wave is dermatoma of deep peroneal. Patient injured fibular bone fracture, loss of evergence, superficial peroneal. Patient pain on the plantar flexion with the tibial fracture, anterior compartment, deep peroneal tendon, posterior to lateral malleolus. Injury is peroneus brevis. Nerve supply to the thighs, medial is obturator, lateral cutaneous nerve. Compartments of the leg, inferior extensors, deep peroneal, flexor hallucis longus, deep peroneal nerve. This is deep peroneal. Posterior compartment, deep flexor hallucis longus for compartment, lateral compartment, superficial peroneal by posterior flexors of the tibia. Medial aspect of the is long saphenous vein, superficial peroneal nerve, lateral compartment, peroneus longus and brevis, dorsum of the foot, except first step, deep peroneal nerve, first dorsal wave, posterior compartment of the plantar flexion by tibial nerve, downward flexion is by tibial nerve, dorsal flexion by the deep peroneal nerve. Only sensory nerve that is not a part of sciatic is femoral nerve. Patient has injury unable to extend the knees. Quadriceps femoris affected by the nerve is again femoral nerve. Commonest site of peripheral aneurysm is popliteal artery. Drainage area of the facial artery is deep inguinal lymph node. Course of posterior tibial artery midway between medial malleus and calcaneus. This is medial malleus, medial posterior to medial malleus tibial artery. Course of anterior tibial artery dorsalis pedis artery continues into lateral to extensor hallucis tendon. This is lateral to extensor hallucis tendon. Patient twisted on the ankle on inversion, more inversion, lateral anterior talofemoral, accident, short leg, internally rotated, posterior hip artery, sciatic nerve injury. Mother found mucinum in the front of pampas, vital intestinal duct. Appendix is derived from midgut. Persistent urachus is the medial umbilical ligament. Median umbilical ford is urachus. Medial umbilical ford obliterated umbilical arteries. Medial, this is median, this is medial, this is lateral, inferior epigastric artery. Epidermis defined mesonephris, ulfan, uterine, paranephrin. Inguinal congenital process vaginalis. Testicular descent is by gubernaculum. Branchial cyst or the second branchial arch. Cleft palate due to failure of fusion of palatine processes of maxilla. Cleft lip is because of medial nasal fusion of medial and maxillary process. Neonate with rectovesical fistula is cloaca. Thyroid origin inferior thyroid is third pharyngeal, superior is the fourth. Internal jugular vein, sternoclavicular joint, lobule of the ear. External jugular ear, middle of the clavicle to angle of external jugular, angle of mandible and lobule of the ear. It comes internal jugular is internal sternoclavicular joint, lobule of ear straight, and external jugular is middle of the clavicle to angle of mandible. This is anteriorly going crossing. Carotid bifurcation C3-4, C4 level by aortic bifurcation L4. Thyroid stomach at the level of 2, 3, 4 rings. Level of T5, angle of Lewis is T4. Tracheal bifurcation T5, thoracic duct crosses behind this at this T5. Diaphragm opening, voice of America V is 8, 10, 12. Chest tube insertion mid axillary line, 5th intercostal space. Remove infusion along against the heart. Do pericarditis angle 45 degree needle to the left. 5th intercostal space, lateral to sternum, thoracic center subclavian. Patient is bending forward table and mid posterior line. McBurney's point, umbilical and the 1/3 junction. Tension pneumothorax, tibia deviated to the left, needle insertion on the right. Contents of posterior mediastinum, esophagus, thoracic duct, trigus, and narrowest urethra, membranous urethra. Branches of renal artery, superior mesenteric artery. Branches of renal arteries, superior, inferior mesenteric artery, middle and inferior. Which level of the spinal cord thus will cause least spastic paralysis than lower neural region, most of the far level ending in the spinal cord. Which level of spinal cord causes hyperreflexia? T12 and above, the most higher reflex, more common route. Ankle dorsiflexion, big toe extension, plantar flexion, little finger, thumb, nipples, fluid distribution. So we'll stop here.